Within weeks of the COVID-19 pandemic's onset, mental health care underwent perhaps the fastest transformation in its history, shifting overwhelmingly from in-person to remote video and phone-based delivery almost overnight. This forced, large-scale natural experiment generated an enormous body of new research on teletherapy's effectiveness, with results that are more encouraging and more nuanced than either enthusiasts or skeptics initially predicted. Multiple meta-analyses comparing video-based teletherapy to traditional in-person psychotherapy, including studies conducted both before and after the dramatic pandemic-driven expansion of telehealth, consistently find that teletherapy produces treatment outcomes generally comparable to in-person therapy for common conditions including depression, anxiety disorders, and PTSD, when delivered by trained clinicians using evidence-based treatment protocols. This equivalence finding held across most demographic groups and conditions studied, though some specialized treatments, particularly certain forms of exposure therapy requiring specific real-world environments, present greater logistical adaptation challenges via teletherapy. Teletherapy's most well-documented and substantial benefit is dramatically improved access to mental health care for populations facing significant structural barriers to in-person treatment, including rural residents living far from mental health providers, individuals with mobility limitations or chronic illness making travel difficult, parents and caregivers with limited scheduling flexibility, and people in geographic areas with severe local shortages of specialized providers, who can now access specialist care located anywhere within their state or licensing jurisdiction. Numerous commercially available mental health apps offer structured, self-guided modules based on cognitive behavioral therapy principles, mood tracking, and guided meditation content, with randomized controlled trials finding modest but generally genuine evidence of symptom reduction for mild to moderate depression and anxiety, particularly for apps developed with input from clinical researchers and tested in peer-reviewed trials rather than the vast majority of commercially available apps, which lack any rigorous published evidence supporting their specific claims. AI-powered mental health chatbots, designed to provide conversational, CBT-informed support for mild distress and everyday stress, have shown some early promising results in controlled studies for reducing mild anxiety and depressive symptoms, functioning as an accessible, always available first-line support option. However, significant safety and ethical concerns remain regarding these tools' ability to appropriately recognize and respond to crisis situations, including suicidal ideation, and regarding data privacy for sensitive mental health disclosures, leading professional organizations to recommend chatbots as an adjunct for mild concerns rather than a replacement for professional care for more serious conditions. A significant equity concern in digital mental health expansion is the digital divide. Many of the populations that could most benefit from expanded access, including older adults, lower-income individuals, and those in areas with poor broadband infrastructure, are also the populations least likely to have reliable access to the technology, private space, and digital literacy required to effectively use teletherapy or digital mental health tools, meaning digital expansion risks widening existing mental health care disparities rather than closing them if not deliberately designed with equity in mind. The regulatory framework governing digital mental health tools, including apps and AI chatbots, has lagged considerably behind the rapid commercial growth of the industry, with the large majority of mental health apps available in commercial app stores never having undergone FDA review or rigorous independent clinical validation, despite often making implicit or explicit therapeutic claims. This regulatory gap places substantial burden on individual consumers and clinicians to critically evaluate which specific digital tools have genuine supporting evidence, a task complicated by the sheer number of available apps and the technical nature of evaluating clinical trial evidence. Teletherapy and digital mental health tools represent a genuine expansion of mental health care access with real, evidence-supported benefits for many patients and conditions, alongside real limitations in equity, regulation, and safety that require careful, ongoing attention as the field continues its rapid technological evolution.